Hi, Sheehan. Thanks for meeting with me today.
Oh, nice to see you.
You too. So I worked with Amelia during her hospital admission, which lasted approximately 8 months, and it's so nice to see her moving into appropriate housing, into a group home, and get to speak with some of the staff that'll be working with her. So before I get started, I'm going to go over a few details. Does that sound okay?
Yes.
Great. So Amelia is a 10-year-old girl who's diagnosed with moderate intellectual disability. She has ADHD, stereotypic movement disorder with self-injury, disruptive behavior disorder, and disruptive mood regulation disorder. So Amelia's problem behaviors include self-injurious behaviors, so SIBs, and aggression. Her SIBs can be defined as biting, pinching, or hitting any part of her body or hitting her legs or shins against objects. And aggression can be defined as hitting, pulling at others' hair, pinching, kicking, grabbing, scratching, and throwing objects within 60 centimeters of another person. These behaviors have actually resulted in large calluses on both of her index fingers and bruises on both of her legs. So while in hospital, I conducted a functional assessment with Amelia, which indicated that her problem behaviors were being maintained by attention. So this means that Amelia would engage in these behaviors in order to get access to attention. And we intervened in hospital using a full session differential reinforcement of low rates of behavior procedure, also called a DRL procedure. Have you heard of this before?
Maybe just a little bit.
Okay, so that's okay. We'll go over it. So full session DRL includes the delivery of reinforcement if the number of the behaviors during the session were less than or equal to the predetermined limit. So, for example, if Amelia engaged in 2 behaviors or less within the 5-minute interval, then we would deliver reinforcement at the end of the interval in the form of positive reinforcement. Or social interactions. And if the behaviors occurred 3 times or more within that interval, then we would withhold attention and we would reset the interval. But we'll go over a little bit of that more before later on. So I'm just going to show you the graph here that we some of her data. So it's the top here. On the side, you can see that this is her behaviors per minute, so responses per minute. Prior to the intervention, so during baseline, her behaviors were quite high, averaging about 18 times per minute. When we intervened with the DRL procedure, there was an 80% reduction in behavior. Then we removed the procedure and we went back to baseline, and the behaviors increased again. And then we implemented the DRL, and the behaviors reduced again to near zero levels. Ultimately, that reduced her behaviors, like the DRL procedure reduced her behaviors by 97%, which is why she's able to move into this group home. So it's very successful, which is awesome. But unfortunately, we're going to have to begin with very short intervals as she's just transitioning out of the hospital. And we want to ensure that she receives reinforcement often. So we will thin the schedule of reinforcement and increase the duration of the intervals once a stable level of responding is achieved. Does that make sense?
I think so.
Okay, great. So we're very lucky that Amelia has received funding for one-to-one support to help her transition back to the community, since this intervention is quite labor intensive. So to begin, you will set a timer for 5 minutes. If the problem behavior occurs 2 times or less within the 5-minute interval, you want to deliver reinforcement. So you want to maybe make brief physical contact by touching her on the arm. You want to deliver positive statements such as "I like your shirt" or "I'm having so much fun with you today" at the end of the 5-minute interval. If the problem behavior occurs 3 times or more within the 5-minute interval, you're going to reset the interval and you're going to withhold attention. So you're going to continue to do this throughout the day, anytime that Amelia is out of her bedroom. I'll also be providing you with a 1-page instruction sheet. In addition, I will come to the group home and I will implement it and show you guys so you guys can watch me do it. I'll also, you'll have a chance to practice it, and then I'll give you some feedback on that. Do you have any questions?
Just one. Is there any evidence that supports the use of this intervention for problem behavior that's attention maintained?
That's a great question. There's actually a lot of research on using the DRL procedure to reduce problem behavior. So typically, DRL is used for behaviors such as vocal outbursts, classroom disruptions, and social withdrawal. But two in particular that used it for attention maintained behavior was the full session DRL was successfully used in a classroom setting to reduce 3 children's inappropriate behavior of requesting for approval and assistance, which was disrupting the classroom. And another study, the DRL was done used successfully to implement to a young man who has sustained a brain injury, and it was successful in reducing a combination of behavioral problems. I've actually will email you these studies so that you can take a look, and I suggest delving into the literature a little bit to read some of these articles and get a better understanding of the DRL procedure. Does that answer your question?
Yes, thank you.
No problem. So before I go, I just want to explain when the DRL should and should not be used. You'll want to use a full session DRL when you want to eliminate the behavior completely. So as zero rates of responding produce reinforcement. However, because of the severity and the intensity of Amelia's behaviors, if this intervention, if you see any swelling or redness or bruising that occurs during this intervention, I want you to stop it immediately and inform myself so I can come into the home and reassess the conditions in the group home setting. Okay, so thank you so much for your time, and I will see you soon.
Great, thank you.
Thank you.
Bye.
Bye.